चैनल को सब्सक्राइब, लाइक और शेयर करें। नोटिफिकेशन पाने के लिए बेल आइकन।
And thank you for coming to something that is so close to my heart. It's with great pleasure that CK Birla Healthcare announces the launch of our 7th and largest fertility clinic under the brand Birla Fertility and IVF today here in Lajpat Nagar, New Delhi. This adds to our existing footprint of Birla Fertility and IVF across Delhi, NCR, Lucknow, and Calcutta. The 160-year-old CK Birla Group is a $2.8 billion diversified conglomerate with interests in Jaipur, Gurugram, and Delhi. For me, it's been a personal passion with the setting up of our two most recent hospitals in Delhi and Gurgaon over the last 4 years, which truly gave birth to this fertility venture. As a young woman, I understand the need for a trusting and expert healthcare provider to go to, and we wanted to create just that when it came to fertility as well. Our hospitals have pioneered several firsts and set many milestones in India's healthcare industry over the last 5 decades. Birla Fertility and IVF is our newest brand, furthering the group's long-term commitment towards trustworthy healthcare.
I hope all of you are comfortable and I'm audible back there. Yeah. Thank you. Thank you for joining us on this very important day for all of us at Birla Fertility and IVF. Many of you would ask, why fertility as a space for CK Birla Group? India is home to nearly 3 crores, 2.75 crore couples with fertility related problems. Put in other words, that's nearly 1 in 6 married couple who face some issues or the other. However, every year, less than 1% of these affected couples actually come forward and seek medical assistance. This is primarily due to lack of awareness and also access to medical help which they can trust, which they can rely on. So this space is both underserved and underpenetrated, not just in India, but that's a trend outside India as well. Across these markets, it is a space that is growing upwards of 15 to 20% per annum. And that's where Birla Fertility and
At Birla Fertility and IVF, our vision is to transform the future of fertility globally through outstanding clinical outcomes, research, innovation, and compassionate care. Committed to delivering quality and patient-centric healthcare, Birla Fertility and IVF will support every couple in their journey to parenthood through clinical excellence, world-class fertility solutions, personalized treatments, and chain of multi-speciality hospitals providing best-in-class clinical care and patient experiences. Birla Fertility and IVF, a chain of world-class clinics providing comprehensive fertility care, is the latest venture under the healthcare brand. Avanti also works on various strategy initiatives across diversified group companies.
Thank you, Ritu. Can you all hear me? Am I audible to you all? So greetings and namaste from Birla Fertility and IVF. My name is Dr. Salwar, and it's my great honor to welcome you all to a very special day for all of us. So taking forward where Avanti and Akshat left, today is a very big day for us, and we are actually from heart honored to see all of you here today. What we believe is all heart, all thanks. हम जो भी करें दिल से करें और बेहतरीन साइंस का टेक्नोलॉजीज का इस्तेमाल करके करें. That is the motto of Birla Fertility and IVF. So we will just repeat. We call it all heart, all thanks. How are we different? We listen every day. हम हर रोज सुनते हैं that the main reason of infertility is female infertility. So in case somebody doesn't have a child, the female is having the problem. So fertility problems are more in the female. Now we want to break this myth, and we want to tell people that man is also responsible for around 60% cases of infertility. So men is equally responsible. Men also have problems which can lead to infertility. So our brand focus will be having outreach and creating awareness not only in the country but globally to tell the world that we should give proper care to the men also who come to our OPDs. They also need very high level of diagnostic and therapeutic care and very advanced surgeries to be done for them. Birla Fertility and IVF believes in offering a very, very comprehensive approach to our patients. We treat male infertility, female infertility, we carry out genetic screenings, we do cancer preservations, whatever is possible in the world we are offering to our country fellow. We are offering at a very high scale fertility preservation services, which some of you may like to ask, what is fertility preservation? A large number of young boys and girls in our country are suffering from cancer. If you look at our own families, we'll all have somebody who has suffered with cancer. And nowadays, cancer is coming at a very young age.
Recording stopped.
So when a young girl or a young boy has got a cancer and we treat them with some sort of chemotherapy or radiation therapy, they tend to lose their fertility. Their ovaries and testes they fail. जब उन्हें हम कैंसर की दवाइयाँ देते हैं तो उनकी ओवरीज भी काम करना बंद कर देते हैं. So we are launching a pan India program that is called ovarian cortex freezing, which will be launching very, very soon. In that, we can take out the ovaries of the woman. उनकी ovaries को हम निकाल सकते हैं, that can be implanted back into her body and she can again become a mother. That's about the fertility preservation services. Young girls, we are also offering, जिन्हें breast cancer है, जिन्हें किसी तरह का कोई lymphoma है, leukemia है, we can offer them oocyte freezing, and we are doing it routinely from past 2 years. At our centers at Birla Fertility and IVF, we are going to offer all the advanced testings which are available to anyone in this world, starting from things like endometrial receptivity assay, PGS, PGD, all will be offered to our people of our country. Social egg freezing is a very common thing. हमने सुना होगा a lot of young women want to preserve their oocytes. That also we are offering at our clinic. We believe in holistic care. बांझपन, infertility, ये दो शब्दों के साथ हम देखते हैं when we talk about infertility, but we call it fertility. We are Birla Fertility and IVF. IVF we are offering, but we are offering completely holistic care to the people. Now, what does the holistic term means? It means that we bring together a lot of teams, a lot of doctors who look after the fertility potential of young boys and girls who come to us, and then we can give them complete care. So we have a team of andrologists who looks after the men. We have a team of nutritionists who looks after the diet. We have a team of endocrinologists. We have got a team of multiple doctors counselors which work together to give a woman or the couple complete assistance in getting their fertility. So in case after we have come, we don't go to IVF directly until it's really required. That's about the holistic care. We are also establishing here a very advanced andrology clinic. As I've told you, nearly 6 out of 10 men, it's a huge number, 6 out of 10 men have got some sort of fertility issues which are easily manageable. Till date, we have been ignoring the men from the fertility problems.
We have planned an outlay of upwards of 500 crores. And in terms of competition, there is, we feel there are a lot of players who've established themselves in the last decade or so. Our attempt is to build a differentiated proposition for patients, ताकि when they come to us, they experience a difference in the quality of care they get and the service experience they get. So, कहीं ना कहीं our attempt is to create that differentiation and a different brand.
बिरला फर्टिलिटी एंड IVF के अंदर कैंसर इन यंग गर्ल्स एंड बॉयज़ वी आर ट्रीटिंग. जो छोटी बच्चियां हैं या फिर anyone less than say 35-36 years of age, both men and women, we can help preserving their fertility. हमारा एक फर्टिलिटी का यूनिट है और हम सिर्फ फर्टिलिटी पेशेंट्स को ही देखते हैं, जिन्हें प्रॉब्लम हो रही है उन्हीं को देखते हैं हम लोग. So heart disease and other things we don't actually cater to. But anyone having cancer definitely will be able to help. We've got all the advanced technologies, equipment, and doctors who can manage young boys and girls who have got cancer. And we'll be starting a pioneering program in the country, which is called ovarian cortex freezing. And same for the men. Young boys, in case they come to us with cancer, इन्हें कैंसर है, उनका भी हम टेस्टिस का टिश्यू निकाल के प्रिजर्व कर सकते हैं और बाद में उनके स्पर्म्स को मैच्योर करके वो माता पिता बन सकते हैं. That's a pioneering work we promise to the country.
इसमें our efforts are on 2 or 3 fronts. First, there is a heavy need to disseminate information and make topics around fertility mainstream. आप छोटे शहरों में जाएं तो अभी भी कुछ ना कुछ सोशल स्टिग्मा अटैच्ड है इससे. बहुत सारे फैमिलीज़ के डिसइंटीग्रेशन का कारण ये बनता है. सो what we are doing is we are organizing camps and outreach programs in these smaller locations where our doctors go. It is not, these are trained, qualified professionals who are going and
हम एक स्त्री के साथ we only communicate with the women. We don't talk to the men. So we are having our training is such that we always spend time with the men, talk to him. And what we have found is that 6 out of 10 men, or even 7, sometimes 8, may have some problems. सबसे पहला होता है बात करना. Once we talk to them, we are able to a competence win. क्योंकि the way our country has been made, the way we are educated.